building trust in this age of misinformation. May I request all of you to please put your hands together as I bring to you someone who specializes in the industry of kids, and that makes her the warmest, the sweetest pediatric out there who's spreading information the right way. Please put your hands together as I extend a very warm welcome and present to you Bachcho ki doctor, Dr. Madhavi Bharadwaj, influencer, MBBS, MD Pediatrics, someone who specializes in connecting dots and chords. Please do put your hands together as she shares the story of how is it that we can build trust amongst our patients in this age of misinformation.
Thank you. Thank you. Thank you. Thank you so much. Oh, I'm sorry. Yeah. Good evening, everybody. बहुत heavy बातें करी अभी सबने. But I'm a pediatrician. I talk and walk, and I'll try to make it a little lighter and short. आप सब सोच रहे होगे, like I'm also thinking, छोटी सी बच्चों की डॉक्टर इतने बड़े बड़े लोगों के बीच में क्या कर रही है? So I had the same, thought the time I put out my first video on Instagram, 27th Feb 23. But then I had a few points to prove to my mothers, to my parents, to the families, and today also I have a few points to share. So they've given me this topic. Okay, it's not flashing, it's okay. So building trust in this age of misinformation. I think there are two things which matter, and हुआ क्या? Last 20 years when, 20 years back, doctors were the most trusted people in the society. They were the most respected people in the society. But aaj I have to talk about building trust. Where did the trust go? Why did we lose it? I think two things happened. First was this avalanche of information on social media. Google, WhatsApp तो इंडस्ट्री बन गया पूरा, वहां से प्राइमरी सोर्स ऑफ इंफॉर्मेशन आ रहा है, इंस्टाग्राम, यूट्यूब, व्हाट नॉट. एंड सेकेंड इज, I can't explain it better than Dr. Girish, but yes, the difference of opinion between two doctors sometimes is the reason for, वो बीज बो देते हैं ना डिस्ट्रस्ट का कि कुछ तो गड़बड़ है, उस डॉक्टर ने तो कुछ और बोला था, इस डॉक्टर ने तो कुछ और बोला है. So both these things together, I guess, is the reason. Somebody says something else, and like I usually say, India में डॉक्टर के अलावा हर कोई डॉक्टर है. So that happens. So much of information, and when it is not taken in the right context, for the right patient, at the right time, it is going to be a misinformation for that family. As a pediatrician, I have to talk about the family actually, because it's not just one person I'm treating, I'm actually talking about the whole family. So, my journey, let's go from the start. I started making these videos because I thought, समझ ही नहीं आ रहा है यार इस मदर को, इस दादी माँ को समझ ही नहीं आ रहा है, मैं जो समझाने की कोशिश कर रही हूँ. Why can't I get through them? Why can't they listen to me when I say, चीनी और नमक नहीं देना है फर्स्ट ईयर में, your kid doesn't need it. Why can't she understand that cow's milk is not the right thing after 6 months of age? Your child needs to eat also. I thought बोलना पड़ेगा, पर उससे क्या क्या changes आएंगे I didn't know. But over this 1 year I've learned a lot, and that is what I'm going to share today with all of you. So over 1 year, from 0 to 1 million people trusting me, I will not say followers, but almost 1 million families connected with me now. They look up to me for everything. इंडिया में अभी भी फीमेल डॉक्टर को सोचते हैं गायनी का काम भी करेगी और पीडियाट्रिशियन भी होगी, बच्चा और जच्चा दोनों को बताएगी. That is not the case, but they trust me, and what I learned in this 1 year I'm going to share today. So first thing I think is staying updated, which we lack. 2017 I passed out from MAMC, Maulana Azad Medical College, and बहुत पढ़ते हैं पीजी में, we read a lot. I was updated with all my guidelines and all. 2019 ESPGHAN, European Society for Gastroenterology and Hepatology and Nutrition, put out a new guideline कि sugar and salt is not to be given in first 2 years of life, added salt and sugar, because it is going to lead to obesity, diabetes and whatnot in future. Following, Indian Academy of Pediatrics also put out the same guidelines. अब अगर मैं नहीं जाके पढ़ूंगी, if I don't go back, if there is no social media, no Google, who is going to tell me that this was the information I needed to update myself with? And guess what? Information इतना fast Google पे पहुंचता है जितना मैं books तक नहीं पहुंच पाती अपनी busy OPD practice के साथ. So this is where social media is a bane, but it is a boon as well for some of us. OPD practicing or even in big corporate hospitals, every doctor has to be updated. So you need to stay updated if you want to connect with your patient, if you want their trust. It will not happen in one day. It will happen gradually. But when you are in tune with today's date and time, US में डॉक्टर बोल रहा है, वहां पे मेरे फ्रेंड्स एंड फैमिली है मैम, वो तो बोलते हैं फ्रूट्स भी नहीं खिलाना है, एंड आप बोल रहे हो कि नहीं जैगरी डाल दो, घी तो हम डाल ही सकते हैं. We are talking about our context. They're talking about theirs. But I have to connect this bridge and explain it to my patient. Second thing, relevance. Today, this mother is not concerned how good I am at treating tuberculosis. Tuberculosis treat करते हैं, meningitis भी treat करते हैं, brain tumors भी treat कर रहे हैं, but normalcy is this, abnormalities are these many. वो बहुत छोटा है. Variation in normalcy is so many. If you don't know your variants, you can't treat your families, babies, patients, whatever. So, staying relevant. Today's mother wants to know, diapers use कर सकते हैं क्या? I was not taught this in medical college. I was not taught about pacifiers or fruit nibblers or I don't know, bottle feeding to हमें बोलते हैं नहीं कराना. But yes, the new things which are coming up, nobody taught us. They're not in our books. There are no guidelines even. But you learn it from social media. You add your experience to it and then you guide your patient. So please stay relevant. Time. Sir was talking about your behavior and patient's inclusion in decision making. आप सुनोगे ही नहीं तो आप पेशेंट को समझाओगे क्या और वो आपको क्यों सुनेगा? We don't have time in our OPDs. When do I talk to my patient? Well, I do talk on social media as well. That is why they say कि आप जब बात करते हो अपने वीडियोस में मैम लगता है मेरे लिए ही बोल रहे हो. That is what I hear and it is very heartening and encouraging for me. So, taking the problems out of their households, जो उस घर में हो रहा है, जो मैं OPD में सुनती हूँ, उसी का जवाब, उसी का solution मैं अपने वीडियोस में देती हूँ and people connect. So you listen, please give time to your patients. URTI, जुखाम खांसी के पेशेंट को 2 मिनट में ओपीडी से बाहर भेजा जा सकता है, बट एक ब्रेस्ट फीडिंग मदर और अब मदर न्यू मॉम विद अ 5-day-old baby cannot be sent back with 5 minutes of OPD time. She needs you. She needs to know what is okay, what is not okay, what her mother-in-law is telling, what friends and families telling. I need to tell her what is the right approach to anything. Please give time. Fourth and very important, counseling. One of my friends said, पीड्स गायनी वाले हो ना, बहुत काउंसिल करना पड़ता होगा. सर्जन को नहीं करना पड़ता? Sir gave a beautiful example of this ortho surgeon. Why? सर्जन को नहीं करना पड़ता, मेडिसिन वाले को नहीं करना पड़ता, oncologist को नहीं करना पड़ेगा. No, you all need to counsel. As healthcare professionals, you need to connect with your patient first. You have to listen to them, counsel them, tell them what are the options they have for the treatment. What are the options, let alone treatment, what are the options, test भी कौन से हैं, क्या कराना है. Know your limits. मैं इस चीज की डॉक्टर नहीं हूँ, please take a second opinion. It's okay to send them out of your hospital setting. It's perfectly fine. This will rebuild their trust in you. कितना अच्छा डॉक्टर है, जो नहीं आता था उसके लिए बोल दिया मुझे नहीं पता. बट नहीं, हमको अपने पेशेंट्स छोड़ने ही नहीं है. नो, सो नॉट द राइट अप्रोच. प्लीज काउंसिल, include them in decision making. And I think the enthusiasm with which I entered medical college, I'll make sure that never leaves me. The moment a patient enters my OPD, they come with a smile sometimes. They'll come with a very bad face also. परेशान है तो दुखी होके आएगा. But when they're leaving my OPD, I want a smile on their face. And that is what I aim even today. वीडियो सोशल मीडिया पे जाने के बाद टारगेट ऑडियंस के पास जब तक रहता है अच्छा रिस्पॉन्स आता है. जब वो गलत ऑडियंस के पास पहुंचता है ट्रोल्स शुरू हो जाते हैं. they'll talk nonsense, they'll abuse you, they'll put out anything, but that doesn't bother me. I know where I wanted to reach if I've made, 5 mothers smile today. Mothers, because most of my videos are about mothers and babies. If I know I've given solution to 10 of them, I am happy. I'm happy that somebody's smiling because of my face today. So don't lose the enthusiasm. Don't lose the empathy. We want our patients to consider us as humans, and we don't consider them as humans is not the right approach. Lastly, social media is there to stay. It is not going anywhere. कहीं नहीं जा रहा है, वो यहीं रहेगा. So irritate होने से, गुस्सा करने से, अरे क्या पढ़ते हो तुम सोशल मीडिया पे, बेकार है, क्या डॉक्टरों को सुनते रहते हो, हटाओ. That is not going to help us out. I tell you, you take their half-baked recipe, it's okay, clean it out. उनके जो गलत notions हैं, please take them away. Put in the right knowledge nuggets and then give them the best healthcare, the fully baked, ready to eat knowledge nugget. They will come back to you. They will have the trust again slowly. Thank you so much. I think this is all I had to speak.
That was absolutely wonderful. Thank you. May I request for all of you all to please put your hands together once again for Dr. Madhavi Bharadwaj.